Hi, this is part 2 of your eye assessment lecture, and this is Colleen Parsons. So we're looking now, we've explored the subjective data, and now we're looking at the objective data for the eyes. And you will be working with the Snellen chart, a handheld visual screener, I'll explain what that is, and a color chart, and a colorblind chart, and a pen light. So the Snellen chart is something that we're all familiar with, and we need to be at the 20-foot mark. That's what the 20 always means, is that you're standing 20 feet away from this chart. Now you can use a hand chart, and it has to be a certain number of inches. I think it's 12 inches from your face, but we will be using the Snellen chart. And we won't always be able, for your actual assessment, for it to be 20 feet away. So that's something you're going to have to say, is that the Snellen chart is 20 feet away. And then your patient will read the smallest letters that he or she can read, and you will, with fewer than, I think it's 2 mistakes, we'll learn that here in a second, you might already know. And we will, given that information, that's what will determine the second number over here. Now what that means here is I can read on the smallest line from 20 feet away, or actually it's this line here. I can read 20 feet away without making any mistakes, or with no more than 1 or 2 mistakes. Then you go up to this line. You can see this is 2025, 2030. So this is what most people can read at, most people can read this at 20. To you, it looks like it's 30 feet away. That's what the second number means here. To you, this line, if you had 20/40 vision, this line would look like you were 40 feet away, when in real life you were only 20 feet away. Sort of getting the idea? We'll talk about this more in class. The near vision card, where is it? Well, this whole thing is blurry, but you're getting the idea. And what we have instead of this near vision card are books. So you read out of this card, and that will give you an idea of your near vision with or without corrective lenses. Now, whenever you write this, you have to determine if the patient is using corrective lenses or not, and you are putting that in your documentation. Confrontation test. We'll learn more about that. Corneal reflex. What you're doing is you're shining a light directly in the middle of, between the eyes here. And the light should appear in each pupil exactly in the same place, depending on where you're shining it. Okay, so you're not here shining it out, you're shining, the light is hitting their forehead. If it's different, you've got these choices. Most everybody in here will be normal. The cover on cover test, be asking the patient to cover one eye, open it, seeing what that eye does, then you take the cover away, and you're watching the eye that was covered to see if it wanders or what that's doing. And then you'll do the other eye, cover and uncover test. Diagnostic positions, you're holding your finger up, you go 1, 2, 3, 4. So you're getting all of the directions for the cardinal directions for the eye. Remind me in class to tell you the story about the pirate's eye. or look it up for yourself, the eye patch. So we begin when we are inspecting a person's eyes. You're inspecting the eyebrows. Is there debris on them? You're looking for symmetry, not necessarily of the brow itself, but the area between the eyes, the bone structure. Do they have any debris or scaliness or bacteria infection? The whites of the eyes, the conjunctiva, lacrimal apparatus, which is the tear ducts again, the cornea and lenses. This is how you can tell if there's clarity or smoothness. If you're seeing any, you look sideways across the cornea and you're seeing if there is any cloudiness or lesions on the eye. It's really hard to tell, especially for a novice, and you are just looking, practicing looking at the iris and pupil. Does the iris appear flat? Is it round? And the same thing with the pupil. We are going to be looking for PERLA. Here's your explanation for PERLA. It's an acronym for pupils are equal, round, and they react to light and accommodation. So accommodation is an other movement that you have to do. You start by asking them. You can do it one way or the other, but I learned you start with your finger, whoops, can't see that. Start with your finger out here, and then you have them look at your finger, and then you bring the finger really close. And do the pupils accommodate to that shift? Do they dilate or do they constrict equally? You're going to be using an ophthalmoscope to view the eye, and you're going to be actually looking into the eye. This is fun, and it is also very difficult for the patient or for the nurse to learn how to do. And we're going to be looking all the way into the back of the eye. This will tell you how to do it. We're looking for the red glow, filling the person's pupil. This is the red reflex. That's the first thing you look for. And then you're looking further on back until you see the optic disc, which is orangey. No, that won't be orangey. Sorry about that. It will be sort of a pearly gray disc. And no, I'm sorry. I was right. I'm getting ears and eyes. Both are happening to me at the same time. So your optic disc is orangey, and there will be little vessels running through it if you get really back in there. You're going to be looking at that creamy yellow, orange to pink. It's going to be round or slightly oval, but we're looking for round. And we'll have distinct margins, though on the nasal edge it might be a little bit fuzzy. And the rest of this is really higher level, so you won't need to know these things. It is important for nurses, and hopefully you'll learn this in your foundations class, to learn how to put eye drops in people, both infants and in adults. So make yourself aware of this, but you're really not going to be tested on visual acuity or anything with children. That's a whole specialty area. Color vision we are going to look at in adults, so you'll have a color vision book and you'll be able to read the numbers or trace the lines. If that book isn't available to you, which I certainly hope it is, we will use another book that has colors in it, and you will be saying the colors. It's Colors of Yarn, I think is what it is. And again, infants and children, very important that you at least have some awareness around this. So take your time and read in the books about this. But again, it's not your specialty. And as you can see, this just goes on and on. The aging adult, however, is very important because you will have a lot of interaction with aging adult, at least through your student years here. So we're looking at visual acuity, which gets significantly diminished by the age of 70. You'll be looking at the ocular structures. Gravity kind of brings things down a bit. Eyelids might occlude the actual eyes. You've seen pictures of them in your book. You've probably seen them in real life with grandparents or great-grandparents. There are a lot of changes that occur in the eyes. They get old and stiff just like everything else. So pay attention to these things, and that is the end of part 2. Thank you.